Hello, my Salon sisters. Welcome again today. Third day in a row. I know I promised there would be no more this week, but I have had some feedback that some salon owners are struggling to put together their management plan because they're a little bit unsure how to apply the risk management process to looking at what needs to be reviewed and knowing what's the right decision to make when there's a number of options available. So today I'm going to do a bit of a workshop. A disclaimer, it could take a little bit longer than it has because there's just so much information to go through, but I'm going to try my best to keep it short and sweet for you. So hopefully you'll get some information out of this. So those who don't know me, I'm Caroline Cooper. Lovely to meet you. I'm the founder of Profitable Salon Creator Movement, and it's a movement where I want to transform salons into harmonious and profitable spaces where the women that work in them and own them can really flourish. So operating after COVID lockdown is daunting and can leave you feeling a little bit overwhelmed about the process required to get you going. So the last 2 days I've done Facebook Lives. The first one was on how to develop your management plan, and the second one yesterday was how to implement it. So this is kind of more connected to the first video. This is actually around looking at that risk assessment, but I think it's really good information to have for general health and safety for salons anyway. But today we're going to specifically look at how to apply risk assessment to the COVID issue in salon. So this is basically just going to be a refresher for those people who understand this already, and a specific look at COVID. And for those who haven't gone through this process before, it might be some new information. So please feel free to comment. I'm just going to make my comments available so I can see them. If anyone wants to comment, so that, because I know that this will be some new information for people. So feel free to ask. There is no such thing as a stupid question. I'd rather you ask and know than sit there wondering. Also, if you prefer to private message me, you can, or just leave a message in the comments later. So welcome. I'm so pleased that you're here. So what I want to start with a take-home message from today. So this will be a lot of information, and some of you may look at it and go, I still feel a little bit overwhelmed by the process. My take-home message is do something and write it down. Whatever you do, write it down, but just do something and write it down. So the only way you can get this wrong is by not doing anything. So this is the intention of yesterday and Monday, was to provide you with some resources and space to just start, to just get something happening, something down on paper. The only way you can mess this up is by not doing anything. So I'm happy, like I said, happy for ask questions. And anyway, a bit of housekeeping first. I am a disclaimer. I am not a health and safety expert or specialist. I am a systems specialist, and I mainly focus on making salons profitable. So I'm just going to use my skills around systems analysis and development to help make this process easier for you. So the examples I give today are just that. They are examples to help illustrate the process of risk assessment and management in salon for COVID. And I'll always tell you, go back to your government rules and go back to your industry and associations and federations interpretation of those rules for specific guidelines. Now, you may not have them yet. Do not panic. Just work on what you do know and can do. And when the specifics come out, like around wearing PPE, then you can apply that. But you can start the process now. I'm going to drop the links into the comments for a number of associations around the world. Even if you don't live in those countries, it's worth having a look at them, because some of them have actually done some really amazing work around developing guidelines for hairstylists and managing COVID in an active situation or in a managed situation. So definitely check them all out. They all have their own little bits and pieces to add to the story. So I think it's worth the more you know. So I'll put all the links for all those in the comments at the end of this. I'm also going to give you a PDF of all the slides we used today, so that you can download it. There will be click-through links in the PDF. So if you want to, you can download it and just click on the link in the PDF and it will take you through to the relevant website. So that's free for you to grab. It's in the Facebook group. It will be available after this Facebook Live. The reason it's in my group is because I can't actually attach documents to my page. Otherwise, I would put it there for you because I want everyone to have it. So you do actually have to join up to the group. There is some questions, but they are purely for me to get information so that I'm getting feedback from the industry about the issues and problems and pain points for you, so I can find solutions using my little system skills to make it really easy to navigate out of those problems for you. So you do not feel you don't have to do them. You can still be granted access even without completing all the questions, but they are there, and I would please ask you to fill them in if you can contribute something. It's just going to help improve the content that I can deliver to you guys moving forward. So they are free to grab. There's no cost. Just go and grab them, and please share them with other salon owners you think may benefit from it. This is a time when we all need to work together collectively as an industry to get through this, because the higher the level of compliance across the industry, the stronger we're going to be moving forward and the more confidence people are going to have in our industry. So after all that, let's begin. So today I'm going to do an overview of the risk hierarchy. I'm going to then talk about what each of the steps in the risk hierarchy mean in general terms and the process for using that in risk assessment. And then we're going to look at some specific examples for each of those and how they can be used to manage COVID in the salon and used to be worked into part of your management plan. Then we're going to look at some overall considerations you need to make around occupational health and safety when choosing your action points. And then we are going to then I'll talk you through the process. Just reiterate the process that we've been going through in terms of getting that plan up and going. There'll also be some links at the end of this for you to see, but like I said, I'll drop them into the comments at the end, and there will be click through on the PDF of these slides. So all these slides that I've got up here today will be available in a PDF for you to take and look at for your own benefit. So let's look at the process of hierarchy of risk. Some of you may have seen something like this before. Sometimes it's an inverted triangle, but this is what we use in New Zealand. This is our hierarchy of risk. And you can see at the top of this is elimination. And this is our most effective method for dealing with risks in the workplace. And it comes down to our least effective, which is surprisingly PPE. So when you are considering PPE as your first line of defense, this is a really good process to work through to see whether there's other options you can do that may be more effective. So this is the process. There's elimination, and then minimization, substitution, isolation, and engineering controls, and then administrative controls, and then finally PPE. So that's the order of most effective through to least effective. So each of those has a little description that goes with it in terms of what they each mean. Now, I've got this slide here. I don't expect you to read it all now. It's very, very lot of words, but it is going to be in the slide in the PDF. So I've put it here so that you guys know what to look for. And this is out of the WorkSafe New Zealand Guidelines around risk management. So if you want to know where I got that, that's from WorkSafe New Zealand. The link will be in the comments below and also on the PDF. So this is the little summary sheet for you guys, and it talks about each of the levels and what it means. What does it mean to have isolation or to impose engineering controls? So now I want to just go through some examples in Salon that you might come across for each of these different points, and we're going to start at elimination and see what we can eliminate first. And then we move down. The risk that we're assessing today is the COVID-19 virus. So it is a little bit specific. I'm not going to look at any of the other risks in Salon. That's for you to do at another time in your own salon. But we're going to look specifically at the COVID risk, and it's a risk on your staff and the people who interact with your business. So let's start with elimination. So elimination. So this is basically what the government has imposed on us at the moment. That is levels 3 and 4. The best way to stop COVID coming into your salon is to not have your salon open, not have people coming into it. So this is levels 3 and 4 where we've not been able to operate, and this is why the government has imposed levels in 3 and 4. They are eliminating the risk from our businesses for us, whether we like it or not. But there is also another option, and that's contactless or online shopping. So for some salons, they have now put in place online shopping and doing that, that sort of thing. And that is exactly what the elimination is. So the elimination works to prevent workers and clients from coming into the contact with the hazard. So this is the first line of defense. And look, to be honest, because it is a virus and because it is carried on people, and we are a people industry, apart from doing those two things, there's very little you can do to eliminate the risk. So we need to move down the scale of hierarchy and look at what else we can do. So the next one is substituting. So this is where we take something that we make changes to the way we operate. We remove things or add things, remove and replace things to remove the risk. So the ones that I could think of, and you may be able to think of some more on your own salon, is things like pay wave, because contact points on that pin pad is a way to contaminate someone, to create cross-contamination. So this is a really good way to think about, are you going to use pay wave, or maybe even bank transfer might be an option, prepaying for services. So that's a good way to eliminate that cash and that FPOS transfer. Disposable cups. Now, you could also eliminate this by not providing drinks, but for many salons, this is part of their service and part of the experience. And so it's really integral in terms of how their salon operates, in terms of their processes for consultation, service delivery, and also pricing. So, you have to weigh that up. And so you could, if you don't have a dishwasher or a dishwasher that sterilizes hot enough, then disposable cups are a way of removing that, substituting so that you're removing that risk of cross-contamination. And the other one is free Wi-Fi instead of mags, so that you're not putting mags out, which people can touch and transfer from client to client. So that might be a way. So what you really want to do in substitute is make changes to your system or your salon that remove the hazard. And so this is not, because obviously we're talking about a virus, it's not removing entirely, but you're removing those touch points where you can come into contact, and you can move from a contact to a close contact by touching these points. So the next one is isolation or preventing contact. So this will probably be where we really start to see some decisions being made in the salon around what you want to do. So the obvious one is fixed screens or barriers between styling bays, so that you can isolate groups of people off. So you have the stylist and her client, and you can literally isolate. Whether you'd make that decision or not will again come down to what your area requires of you. Entry and exit controls. So this is where how you manage your entry area. So for some people, that might be that you have clients wait out in the car, they text you when they arrive, and the stylist comes out and meets them, and then they might do a pre-start survey there before they even get out the car. But if you are in a shopping mall, if you are in an area that doesn't have accessible parking, if you work in an urban centre where people walk to your salon rather than drive, you may have to look at different entry and exit controls. So physical distancing is the obvious one. This is what we have been talking about since the virus came out. The key here will be in terms of moving bays or seats apart so that people have that space. And this leads on to my next point, which is extended opening hours. So what you might do is stagger shifts so that you have less stylists but working for longer hours. So that means that rather than being open for 8 hours, you might now be open for 16 hours in 2 8-hour shifts, or 14 hours in 2 7-hour shifts, so that you can just allow for that social distancing. So they are isolating. You're keeping those little bubble clusters really small and isolating the spread of cross-contamination to multiple people. So the next one is engineering controls. So these are things like putting an exhaust fan in to extract contaminated air, opening a window. It's a virus. It's, a really effective way to do it. Again, you want to look at the season you're in, because that might not be applicable if you're down the South Island and the winter's coming up. But, it is an option if you are in a climate that can take that. Hand washing is an engineering control. It's a way of putting physical controls around it. So it doesn't stop you touching the disease or contracting, getting it on your hands, but it's a way of removing and eliminating the risk of getting infected. And sanitisation of tools and surfaces is another engineering control. So these are obviously less effective than eliminating it entirely, but they are effective in terms of once it comes into the salon, in terms of mitigating that risk to the other people in the salon, both your staff and your clients. Then the next one is admin control. So this is where we will use a lot of this around here. It's staff wellbeing surveys. So just recorded ways to check in with your staff and make sure they're fit to work. Like a good way I thought of doing this was perhaps on Google Docs, so that you have a record of their responses. And, just to make sure that they're not coming in, that there's no one in their household who is sick or has COVID symptoms, that they're not sick and have COVID symptoms, that obviously they haven't travelled overseas, but, anything that would give you alarm that they may be unwell. So, and just also checking in with their mental health and all those other things as well. And they need to be an ongoing thing. So they're just an administrative control, checking in regularly. Contact tracing information. So that's really important in terms of, knowing who comes into your salon, how long they're here, who they talk to and who they have contact with, and when they leave. So that if there is ever a problem, anyone who has been in the salon during that period that an affected person has been in can be traced really effectively. So your pre-service questionnaires. So before you even start your clients, the 4 key questions you have to ask them. Have you travelled overseas in the last 14 days? I mean, it seems a bit redundant now, but I think you still have to ask that question because there are still people coming into the country. Have they been in contact with anyone who's had a confirmed COVID case? Has anyone that they're in contact with experiencing symptoms of COVID, or have they themselves been experiencing? They're the kind of 4 questions that you want to be asking all your clients before they come in, and this is an administrative control. So this is a way to try and prevent contaminated people coming in, and but it does require some level of honesty, and also just because they say no to all those doesn't mean they're not infected. And then having your salon COVID management plan, and this is what this is part of, but this is all, so that's covering your things like your hygiene, your sanitation process, your emergency response plans, all that sort of stuff as well is part of your administrative controls you're going to put in place for your COVID management. And the next one is PPE. So PPE is actually the last one. There is the top 3 of those we already do. Whether the use of those will be extended into other parts of the service that they don't traditionally go into. So that obvious one, it will be stylist aprons, stylist wearing aprons, or even disposable aprons for every client, not just for colouring. Gloves, whether they will be used until the hair's washed, or for more of the service. And then whether masks or face shields will be introduced, particularly around blow drying. That will probably be the issue. But the idea there is to protect individuals from the hazards. So that's the last one, because it's just protecting the individuals. It's not protecting the whole workplace. So as you can see from those points, you may find that you have a hazard that you cannot eliminate, so you have to try and put in isolation controls. But you also might need to put in some administrative controls and some PPE, all to manage it at that one point. So certain high-risk touch points like entry and exits, the actual service itself, and those sorts of things, they may need more than one control. So if you can't eliminate it, which you probably won't be able to if you've got clients coming in, you might need to find that you need to do, one isolation, one engineering control, and administrative control and PPE. You might find that you have to do a number of them. That's okay. You need to do what you need to do to make sure that you are protecting your staff and your clients. So these are consideration points. Now, these are outlined by WorkSafe New Zealand, and I think they're really effective in terms of being questions that you ask yourself when you're before you start your plan, so that you know them, and then after you've finished your plan, so that you know that you are the plan is fit for purpose. Because the most important thing you need to realize here is that if you write a plan and you do it, you have to implement it. And then when you implement it, you have to review it and document it. So are there any risks? So we'll go through these points first. Are there any risks from restarting your business or business activities that's been shut down during alert level 4, and how will you manage these? So is there anything you're going to have to look at? Like, are you going to have to do a big clean because there's going to be dust on the floor and it's going to be slippery? Those other things that come up that we may not consider as direct COVID things, but are workplace safety issues. So there's an opportunity there to look at things that may need to be addressed as part of this management plan before you start. So how will you ensure workers know how to be able to keep themselves safe from exposure to COVID? This really goes back to that point I may have made yesterday and Monday. Training. Involve your staff in the process, ask them for their feedback and train them, get their feedback, implement it and train it. This has got to be a process. This is so important that we get right. So how will you gather the information on the wellness of your workers to ensure they're safe and they are well to work? And we talked about that in before in terms of administrative control. So I gave you an example of using Google Docs, but you might have another process that you can come up with that's more effective for your salon. So how will you operate your business in a way that keeps workers and others safe from the exposure of COVID-19? And this is exactly dealing with this point here is exactly what we talked about on Monday, developing your management plan so that you have a plan and a process to create the plan and implement it. Those resources are still available in the group, so they will be available indefinitely in the group. So please jump in. It's not on the page. I can't put them on the page. They are in my Facebook group. So make sure you jump in there and grab those. How we operate your business in a way how will you manage exposure or expected exposure to COVID? So this is really important. So if you have a staff member who suddenly comes down sick and they go off for testing and they're tested as either a confirmed or a suspected case of COVID, how then will you manage your business and how will that be dealt with within your business? How will you evaluate and continue to renew whether your work process and risk controls are effective? So this is that whole review process we talked about yesterday in terms of training, getting your staff involved, looking at your timeline for reviewing these things. And how do the changes impact on the risk of the work that you do? So this is another thing is like if what you're doing, so for example, if the answer was wearing gloves to do all your work, to how does that change the risk of the work? Now, I don't know if you've ever tried to cut in gloves, but it is actually quite dangerous. So there is other risks that now come in place in terms of wearing gloves all the time, even wearing masks all the time poses additional risks around visibility, around being able to breathe effectively and stay cool, around the stress on the lungs and that sort of stuff for people who are working and having to wear a mask the whole working day. So how will that impact? So think about that as well. So if you can have an answer to all those questions, you are doing really, really well. You're well on your way to being COVID compliant, and you are really doing what needs to happen to get people the confidence in our industry back up. So the next step this is going through exactly what we've talked about in the last couple of days, is talk to your team is the next step you really want to be doing. Seek advice when it becomes available, and that will be from both your government and your local association. I will put the links to the association in this, and also WorkSafe New Zealand, because they have some really effective steps, which is, I've sort of taken a real steer from them today in terms of putting this together for you, around how you should go around managing your risk assessment. Write a plan. It's one thing I can say to you is write it down, because it's really important that you have something written down. And if you think you're going to get it wrong, one thing I'll tell you is not writing something is the only way you're going to get this wrong. You need to write something down. You need to train to your plan. You've got about a week, I would say, rough estimation, to get online with your staff and to start training this, having conversations. And you can either do it as I'm doing it now, just talking to you, or you can have a question answer on a Zoom situation, or you could potentially do some role playing. And role playing is really great for dealing with those what if scenarios, and allow you to flesh out where the problems might be. So the next thing I also want to make a really big point of, and this is something that we don't often do as hairdressers, we're a little bit naughty in this regard, and this is recording what you do or what you did. So with your plan, and you'll see this, the reason I wanted to get you starting to write this stuff down and not just telling people or just writing a list, and actually having a plan that you've developed, you want to show how you've arrived at the decisions you make. So if you go back to on Monday, the resource there, it asks you to say what you currently do, what the guidelines are, and what the implementation ideas were. So just by going through that process helps demonstrate your reasoning and how you've come up with what you've come up with. Because if there is a problem and you are audited, you want to be able to demonstrate that why you have made the decisions you have made, and not just tell them on the spot. You've got to have evidence that you can show them that. It's not so much whether the decision was right or wrong, it's that you have evidence that you thought about it. And so this is why I say record what you did. Use those two resources. You can add to them. You can use them as starting off with your notes, or you can use another resource entirely. But whatever you do, write it down and keep a record, and then review your plan. And it's really important, because what will happen is that the situation may change, the government's alerts may change again, and they might find new information out as we learn more about COVID that will perhaps help us. And also, we have to keep continually assessing, when we decided to do these things, are they giving us the results we wanted? So it's really important that you continue to review your plan. So if you look at those steps, and if you just keep putting those in a loop, you will be fine. You will be fine. And it doesn't have to be, the biggest manual that you've ever created. It just has to really cover those main touch points and really look to keep your workers and your clients safe from COVID. So, so the extra help. So these are the places that I've gone today to look for information on how to put this together for you. And so I have, I'm going to put the links to all these websites in the description. So give me a minute after to get that happening for you. But they will also be in click-through version in the PDF. So if you want to grab the PDF, so you've got all the slides to look at for ideas, if it makes more sense to you, then you're more than welcome to grab that and share that with whoever you want to. It's free for you to use. But if you don't grab that, I will put these links there for you to look at. I just want to say shout out to the Australian Hairdressing Council. I was really impressed with what they had put together for their hairdressers. But all of these websites have valuable information. So please just have a look what's happening out there, what's happening in the industry. This is not a phenomenon that's unique to your area. It is something that is happening globally. And as a collective group. We really need to band together. We really need to demonstrate that we're taking this seriously, and we are putting effective controls in place to really allow people to have ongoing confidence in our industry that we do keep our workers and our clients safe, and that is a real priority for us as an industry. So I hope you have found some benefit from this today. This is hope you worked you through the processes of just reasoning, working through what you might need to do and what you might need to put in place. I do appreciate that some of the information and the guidance that you do require, particularly around the levels of control on that, the physical distancing in the service, is still not here yet, and we may not get that till the end of the week. But there is other areas which you can already start to develop your plan. You know you're going to need contact tracing. You know you're going to need an emergency response plan. You know you're going to have a sanitisation plan. You know all those things already, you know that. So you can work on those. When it comes to the actual service, my advice is go back to what we talked about on Monday. Survey your clients, look at their expectations. They're the ones who are going to want to buy your service. Are they going to have confidence? What is their minimum expectation? And perhaps even brainstorm a few strategies. Talk to your staff about changing work hours and all those sorts of things as options depending on what comes out later in the week or what information we get moving forward about when it's safe to come back to work. So again, the resource for this is in the group. Feel free to grab it. It will be this video will be available for you to share or re-watch for a week on my page, on the Caroline Cooper page. After that, it will expire, but there will be a copy for you to watch full version on my blog over at www.profitableSalonCreator.com/blog. So that will be there, plus with all the other stuff that I've done on COVID. So make sure you're looking at it. And if you're having trouble finding the resources in the page, it is under the tag reopening after COVID-19. So if you can't find the actual post with the resource on it, go and just search by the tag. So apart from that, thank you very much for joining me again today. It was a bit unplanned. There was a lot of information, and I hope I've delivered that in a way which is logical and makes sense and provides you with some clarity around the process you have to take in terms of getting your result for your salon. Remember, 2 things today. Just do something. Doing nothing is the only way you can fail at this. And the second thing is you may need more than one hierarchical control. So you may need like administrative control and isolation and PPE. So it is okay to use more than one on high risk touch points within your salon. So if you're thinking you're using 2, that's fine. You might need 2, you might need 3, you might need 4. So that's fine. You need to do what you need to do to make sure that risk is minimized to the minimum you can make it. So thank you very much for joining me. If you have any questions, please leave a comment and I will answer them. If you want to direct message me, I'm more than welcome. I'm more than happy for you to do that. Otherwise, I will see you on Monday, where I'm going to talk about choosing your salon product brand, and especially in this global market where it's becoming more and more important in terms of driving that profitability for your salon. So thank you so much for joining me today, and I appreciate your time. I know it's precious. So thank you very much. Bye.